All righty. Good evening, everybody. We're just going to give a little time for folks to join us to our Wednesday webinar hosted by the Office of Orientation and Transition Programs. Thank you so much for joining us tonight. I see the numbers going up just a little bit. We will give folks time to get in. And also, it's just a little after 6. So again, I see those numbers going up. Well, thank you so much. My name is Tab Enoch. I use she, her pronouns. I work in the Division of Student Affairs and specifically in the Office of the Dean of Students. I get the pleasure of working with our orientation program each year, welcoming our new students and their families to the University of Virginia. Just a couple of things that I want to point out before we get started with our webinar. The first thing is, if you have not gone into your task list, which I'm guessing most of you have gone into your task list, to begin and continue to complete those tasks. We add tasks even over the course of the summer. So I would encourage you just to go in and make sure that you have all completed all of your tasks. Summer orientation begins on Monday. So for those of you all who are registered and attending session A, we can't wait to see you. That said, we will be, again, holding orientation over the course of the entire month of July. And so if you still have questions about orientation, don't hesitate to reach out to our office at orientation@virginia.edu. So happy to answer any questions there. And the last thing that I will say is that all of our email communications is going to your UVA computing email address. So please continue to check your UVA computing email address. So mine, for example, is the TG2K. So you want to check that one because we're no longer using the email address that you applied to the University of Virginia with to communicate. So please do that. We're sending all of that information to your UVA computing ID. And without further ado, I'm going to turn it over to my good colleague and friend, Nicole Ruzak, who is the Chief Mental Health Officer here at the University of Virginia and has a lot of oversight, responsibility, and experience, and a college-age daughter, and student health and wellness. Nicole, thank you so much for joining us tonight. And we can't wait to hear what you're going to share with our students and their families. And Dr. Ruzak, over to you.
All right. Thanks so much, Tab. It's wonderful to be here and talk to you all tonight. I'm really excited because those of you who are here are already investing in your health and wellness, and that's near and dear to my heart. So it's great to know that I'm speaking to folks who are really interested in knowing what they can do to take care of their well-being while they're at the university. It is a huge transition time where students are starting to navigate the process of taking care of their health and well-being more independently. And we at Student Health and Wellness really pride ourselves in being able to help students to learn, how to take those steps, what they really need to know as they're moving out into the world beyond the university when they're looking for healthcare. So it's not only that they can receive good healthcare while they're at the university, but they're also learning how to make good decisions for themselves to be able to use those skills after they leave UVA. My colleague Meredith Hayden is supposed to be here tonight, but it seems like she may be running a little late, so she may join me shortly if she's able to get here. She is the Chief Medical Officer, so my counterpart. We kind of think of ourselves as the mind and the body of student health and oversee a number of different departments or units within student health that I'll be talking about this evening. All right. So we are really proud of our services, but particularly proud of our staff and our beautiful building, which you see in this picture. So for 2 years in a row, we've been voted by the Princeton Review as the #1 student health in the whole country, which we're particularly proud of and we'd like to brag a bit about because that vote actually comes from students. And so it is students submitting their own opinions and thoughts about the health services at UVA. And again, #1 in the nation for 2 years is pretty remarkable. That picture is of our building and which was constructed recently and opened in 2021. It truly is a state-of-the-art space. Right when you walk into the building, you'll immediately notice lots of natural light, really soothing colors, and it was designed with wellness in mind and the idea that the moment you walk in, you should already start to feel better. I was recently recently talking to a group of students who were telling me that this is a place actually they come to hang out because they feel so calm when they're there. They feel safe. They feel like it's just a place where they can really find a little nook to study or hang out with some friends or use one of our many services or rooms to attend to their well-being. We are open from 8 to 5 in terms of all of our services that we offer. And then during the school year, we're open till 2 a.m. The building is open till 2 a.m. We close down our services, but students can come in, they can bring in clubs, they can, again, study there, or just find a place to relax if they, want to kind of get out of their dorm and be in a different space for the evening. So it really is a place that anyone should come check out, even if they don't need a medical visit or a mental health visit. All right, so we have a number of different units within our space, and we offer mental health services, medical services, well-being services, which I'll go over shortly, disability services, and care and support services, which I'll also explain in more depth. Our goal really is to promote the health and well-being of all students at the university. And so we really want to make our space welcoming to all students, regardless of, the reason that they're coming in or where they're coming from. Some students really have never sought out healthcare on their own before, or maybe have never sought out mental health care ever before. And we do our best really to create a welcoming environment where we have medical providers, mental health providers, and other staff who have been specifically trained and really devoted their careers to working with the college student population. Many students say that this is kind of the first place where they've been able to come and have a conversation with a doctor or mental health provider in a way where it feels like they're making their own independent decision and having really a truly collaborative conversation with their provider. Which is really wonderful to hear because then again they develop those skills and can use those after they graduate. All right, so I'm going to go through each of our service areas, and please do feel free to enter questions into the chat. I can't monitor those directly, so I'll let Tab do that. And then as we have questions, I can answer those at the end. But the first set of services that I'll go over are mental health services, which is my area. And prior to my role as Chief Mental Health Officer, I was the Director of Counseling and Psychological Services for 7 years. And prior to that, I worked as one of the clinicians in the counseling center. So I've been there for a total of 13 years and know the space really well. CAPS is what we're affectionately called. That's short for Counseling and Psychological Services, but that's what we're called on grounds by the students. And we provide a range of services, so psychological and psychiatric assessments for either ongoing psychotherapy or psychiatric care. We provide referral and case management services or care management services for students who are looking to connect with care out in the community. We never want a student to feel like they have to navigate either their insurance or seeking out a provider on their own, which can be daunting. If any of you have tried to find a mental health care provider who takes your insurance in the community, you will probably be able to speak to that it can be a really daunting and difficult process. So we really sit down with students and our care managers help them to identify someone who would be a good fit and then how to connect with a person who will take their insurance and is, they're able to get to through either public transportation or otherwise. We offer individual and group psychotherapy. So most of what we do is one-on-one psychotherapy with students, but we have a growing number of groups. This last semester, I believe we offered 15 psychotherapy groups and on a range of topics. And many students find that that's a wonderful way to connect with peers, to meet people who can really relate to their concerns, and they can both give and receive help. Like I mentioned, we have psychiatric services, so we do assessments as well as medication management for students. We tend to want students to both be doing therapy and psychiatry at the same time. So if a student is seeking out psychiatric services at the counseling center, we'll probably recommend therapy if they're not already in therapy. But we just like to give students a heads up about that because we don't typically provide psychiatric services alone. We have a number of crisis services or emergency services. So between 8 and 4:30 every day, students can walk in really for any reason. We don't define what a crisis is, and they can talk with a clinician, usually within 15 to 20 minutes, and typically less than that. We have after hours services as well. So if a student feels like they're in crisis after hours, they can call our main number and they'll get connected with a clinician who can help them manage whatever might be happening in that moment and give them appropriate referrals for follow-up. And then we also offer telehealth. So our clinicians will meet with students through HIPAA compliant Zoom. Sometimes a student, for some reason, they get sick or they're running late and rather have a Zoom session, so we can switch from the in-person to the Zoom really easily. And that is very convenient for students. But I'll add to that as well, if a student is already connected with a telehealth provider, say back home, and they just need a space to meet with their provider that's private outside of their residence hall so they don't have to be around other students, we have telehealth rooms at CAPS that students can reserve ahead of time and come in and have their sessions. We also contract with a service called Timely Care, which is an online telehealth service. Every UVA student has access to Timely Care, and they get 12 free individual therapy sessions per academic year. So this is a great option for students who may want to do about 12 sessions a year and then 12 more the next year and 12 more the next year. Sometimes students will start at the counseling center in person and then switch to Timely Care. Sometimes they start with Timely Care and then they move over to CAPS. So they can kind of mix up, how they want to utilize the services that we offer through UVA. So they offer, as I said, scheduled counseling. They also offer psychiatric services by referral. So either referral from one of our clinicians, or if one of their providers thinks that they should be connected with psychiatry, they can consult with us and then get that referral. They offer some group sessions periodically. They have self-care journeys. So if a student goes online and they just want to engage any time of day, they can do that through Timely Care and kind of learn about stress management, sleep, substance use, and a whole host of other things. And there's a peer community where there's a chat function and they can engage with their peers and give and receive advice about different things that they might be struggling with. One of the wonderful things about Timely Care is that it is covered in all 50 states. So if a student goes home during the break and they are out of state from Virginia, they can still engage with Timely Care through the platform. And it's also available pretty much any time of day. So if a student say wants to engage in therapy or psychiatry at 6 p.m. at night or on the weekend even, they have that option through Timely Care. All right, so medical services is another area that we cover for students and probably, well, definitely our most utilized clinic. And students come in really for a variety of concerns, and medical services serves a few different functions. The main area that they cover is really primary care. And so seeing students for kind of your routine medical needs, a student may get a cold, have a sore throat, maybe they're running a fever, they want to get that checked out. Typically, they can be seen within the same day, I think almost always, and usually it's within even just a couple of hours. All a student needs to do, and I'll describe this more later, is to go online through our online portal and schedule an appointment. And again, usually they can be seen within 1, 2, or 3 hours, which is wonderful. They also offer preventative health, so really meeting with students to talk about how they can prevent illness, giving them a physical, talking to them about different medications that might be appropriate for them for prevention reasons. We also have nutrition services, so if a student wants to learn more about how to take care of their health through healthy eating and nutrition, they can meet with one of our dietitians. They provide really kind of routine in-clinic procedures that are pretty minor, but if a student needs stitches, or sometimes they may need an IV, say they're having a migraine or they're dehydrated for some reason, they can be observed and get that care right in the clinic. They also coordinate referrals to our medical center, which is literally just 2 blocks away. So, and it's a world-class medical center that's able to see pretty much any concern that a student may have. And so if the care can't be provided at medical services, it typically can be referred, again, just a couple of blocks away to UVA Health. They also provide some telemedicine. We have radiology so that students can get x-rays without having to leave the building, usually immediately after their appointment, don't have to wait, get results back almost immediately through the health system. They're returned very rapidly. We have a lab, so right within student health, so students can get blood drawn and again, get the results very quickly. And then we also have a pharmacy in our building on the first floor where we fill prescriptions as well as sell over-the-counter medications, really at almost, really at cost. So really is a good option for students who are on a budget and, want to be able to get their medication without, breaking the bank. All right, so as I mentioned earlier, we also have what we call well-being services, and these are really designed to help students take care of their health so that they don't end up perhaps needing to engage in more intensive services further down the road. And so we hope that most students will take advantage of these services while they're at the university to learn about their health and well-being and really develop those healthy habits. One of the aspects of our well-being services is our teaching kitchen, which is that picture in the upper right corner. And this is a beautiful space where students can come in. We bring in chefs from the community and they offer recipe ideas to students and then actually teach them hands-on how to cook and teach them really like what the nutritional value is, how they can do this within their own living space. So it's a really good opportunity, again, for students to learn those skills that hopefully they can use after they leave the university. We also have an art space, which is the lower left picture that you see there. And this is staffed by our psychotherapist who specializes in art interventions. She will either have just open time for students to come in and use the space, and she'll sit in the corner and engage with them as they want or need and kind of guiding them through some processes to engage with the art materials. And then she also has workshops that she offers on a regular basis. So we've had things like knitting workshops, working with paint, and she usually has a theme around mindfulness or stress reduction, or topics that are really help students, again, to be focused on their health and knowing how to take care of themselves through a modality that they can hopefully then use out in their lives otherwise. The space is also open when she's not there, so students are free to drop in and use the materials themselves as well. We just ask that they be respectful of the materials and leave the space clean. We have a functional exercise program, so that's the lower right picture. So functional exercise, most people have not heard of. It's a really, really cool program. And I like to describe it as being somewhere between physical therapy and personal training. It's not quite either one of those things, but it's a little bit of both. But what the physical therapists do who work there is they do a thorough assessment with the student who comes in, and usually students come in because they're either struggling with an injury or they just want to get into better shape, or perhaps just want to learn more about what is exercise, how can I incorporate that into my life more on a regular basis. So they'll do a thorough assessment with the student, really understand their needs, and then provide them with an individualized program for how to take care of their physical well-being. Sometimes we even refer students there who have mental health concerns, say anxiety or depression, who we think would benefit from a physical exercise intervention. After they meet with the physical therapists, they then get connected with student interns who work there, who will meet with them on a weekly basis to help them to engage in those practices and develop skills that really are, as the title says, functional, so that they know how to go again into their lives and do things in a way that's going to be healthy and take care of their bodies. So really learning like lifting skills, or increasing their flexibility, increasing their strength, so that they're just more able to function in day-to-day tasks. We also have well-being coaching through our program called Wahoo Well, and this is with health coaches who will meet one-on-one with students and really talk with them about whatever they might be struggling with in terms of trying to attend to stress or um, trying to increase wellness in their lives. So a lot of students come in struggling with things like procrastination or stress management or maybe substance use. And they just want a few extra tips on how can I increase my health and well-being? How do I change my habits? And they'll meet with students usually 2 to 3 times, offer them some suggestions, and then follow up with them and kind of hold them accountable to starting to make those changes. So it's a really wonderful program. Honestly, I wish I could use it because there's some times where you just feel like, I know I need to do this thing, but it would be really helpful if I had a professional kind of set out a plan for me and follow up with me to make sure that I'm doing the right thing. And then finally, we have a collegiate recovery program, which is for students who are in substance use recovery, where they can meet with peers who are going through the same concerns. And they really can be in any stage of the recovery process and learn about, how to engage in activities at the university that don't involve substances and that are safe and that they feel, that they're able to connect with in a way that helps them to maintain their health and well-being. All right, so the next area is student disability access. So this is called SDAC at UVA, and this office provides accommodations for students who are struggling with either mental or physical health concerns that may be getting in the way of their functioning. And they need accommodations either within their living space or the learning space, the classroom, in order to be able to function just as other students would. And so the SDAC specialists will meet with students. They'll do an intake. It's really helpful if students have already had accommodations, either in high school or earlier, if they could bring in the paperwork that they used to support those accommodations previously, bring them into the SDAC advisor, and then get set up with academic accommodations or, again, accommodations in the living space. So that they're ready to go. If a student doesn't have that kind of paperwork already in place and they're just wondering if they might benefit from these services, then SDAC will provide consultation and screening services for the students, typically to get a sense of if this might be something that would be helpful to them, and then to refer them to the right place to get more of a diagnostic evaluation. Sometimes that's at CAPS, sometimes that's to medical services. Sometimes that's to someone in the community for more extensive screening. Right, and then finally, care and support services. This is our newest unit within our building. They just moved in this past semester. And they used to be located in Peabody Hall, but now they're in Student Health and Wellness on the 4th floor across from the Counseling Center. And they provide non-clinical case management type support. So they meet with students for all kinds of concerns, whether that is a mental health concern, an academic concern, a financial concern, a belongingness concern. Really, if a student is struggling with almost anything, this is a really good place to start, where they will meet with one of the deans who can go over what the issue is that they might need some support with, determine where is the best place to connect with ongoing support to attend to that need, or sometimes just get enough advice to be able to go back into their lives and function more fully and successfully. They really help a lot of students with basic needs concerns. So really that includes food insecurity, sometimes housing insecurity, financial insecurity, and they really have access to a lot of different resources. And most students have no idea that these resources even exist. And even though, they're advertised on various websites, but once they learn about how easy it is actually to connect with some of those resources, it's often a huge relief to students who are struggling. And once those needs are taken care of, then they can focus more fully on their social lives, their academic lives, etc. So highly encourage students, if they just feel like, what, things feel a little out of sorts in some way, but I don't know where to start. Care and support services is really the perfect place to start. And those deans will help them get connected with what they need. All right, so now I'm going to go over some practical things about how to get connected with student health. So as I mentioned earlier, we have our online portal through Healthy Who's. So all students have access to Healthy Who's. They can go on there. I encourage every student, regardless of if you think you're going to use our services or not, just check it out. Go online. Um, Sometimes you need to submit paperwork there. But if you do need to make an appointment at the last minute, you're not feeling well, it's really good to be familiar with this resource and how to access the services quickly. So students can make most of their appointments directly through the Healthy Who's portal. There are some appointments where they do need to call to make the appointment because we need to ask them a few questions first. But they'll get a pop-up with regard to that, and then they can call one of these numbers to set up that appointment. Talk Now is a service through Timely Care. So when I talk about Timely Care, the telehealth provider, I forgot to mention Talk Now. But Talk Now is an on-demand service, so it's not scheduled. Students can access it through Timely Care, through the Timely Care app, immediately, usually get connected with a provider within 4 minutes. It's really meant as kind of an in-the-moment, one-time kind of consultation where the Timely Care provider will talk with the student about whatever might be on their mind, whatever their concern might be, and then refer them to the appropriate place for ongoing care. Care and Support Services does not use Healthy Who's, so students either need to email Care and Support Services at cass@virginia.edu or give them a call. And after hours, they can speak with Cass On Call. So they also have after hours services for students who might be struggling and need to make contact with one of the deans. And so they can just call that number and get connected and speak with the dean immediately. All right, so a common question we get is, how much is this going to cost me if I come in? This sounds amazing. How much is it going to cost me? Well, the good news is that a number of these services, most of them, in fact, are already covered in tuition and fees. So when a student comes in, they're not going to have to pay anything for their visit. So that's for any visit with a doctor, an NP, a nurse, any of our mental health providers. Those are all already covered in tuition and fees, so there's no additional cost. What there is a cost for, sorry, might be in the next slide. I don't usually do this slide. This is usually Meredith. So all of these things are covered through the fees. Oh, it doesn't say what's not covered. So what isn't covered is lab services, x-ray services, anything that's pharmacy services, anything that's an auxiliary to a visit typically needs to be paid for through insurance or out of pocket. So the other question we get frequently is about confidentiality. And we like to emphasize, again, that students are coming to the university. Most students are coming in as adults, so we also understand that not all students will be 18 when they arrive, but many are. As an 18-year-old, they are adults and they have all the rights of an adult to seek out care that is private and confidential. And so we will not share any information with their parents or with anybody else unless they give us their written permission to do so. Sometimes it's verbal permission depending on the situation, but typically we try to get a written consent form. So oftentimes we do think it's helpful to include families in a conversation about a student's health, and we will absolutely talk to the student about why we think that's important and how their parents or caregivers might be helpful in taking care of their health needs. But we want to make sure that the student understands why we think that might be helpful and then get their consent to have that conversation. Sometimes students bring it up with their own, and then we're happy to work with them to facilitate either a meeting with the family or to have that conversation on our own with parents if needed. This italicized portion at the bottom we like to emphasize is that we do not have a blanket consent form that parents can fill out ahead of time and get consent to talk to us whenever they want. We really do that on a case-by-case basis because every situation is different. And then also sometimes students change their mind. Maybe they're okay at one point sharing a lot of information, and as they start to mature or maybe develop a life, outside of the home, they decide that they want to share less information for whatever reason. And so we want to, again, respect that they're adults and allow them to make that decision if they like. All right. So things for you all to know and to do at this point. So these are the important things to do during the orientation period before you arrive at the university. So the first thing is to fill out the pre-entrance health form and to submit that. Again, this is usually Dr. Hayden's part of the conversation. She actually designs that form and is in charge of this process. I believe that students do have to submit that through that Healthy Who's portal. And so again, that's a reason to get familiar with the portal, and that will give you access, and then you'll start if you want to look around and see the other aspects of what's provided there. But they will need to submit that form by August 1st. They also need to submit proof of health insurance. And they're able to do that between July 15th and August 30th. Or if they aren't going to get health insurance through their family's plan or otherwise, then they should enroll in the UVA sponsored plan. And so we encourage, families to be thinking about that, starting to make those decisions now to make sure that they do have that coverage, because it is mandatory for them to have insurance when they arrive at the university. If you scan this QR code, you will go to our orientation website. There's lots of instructions. We have a new student checklist of our own. Highly encourage students to go through that with their families to make sure that any questions are answered and to make sure all those different pieces are in place with regard to, do they have, again, the insurance, or have they identified providers in the area, et cetera, that they might need when they get here. Oftentimes what we find, or maybe not oftentimes, but it does happen enough, and it's unfortunate that, a student gets here and they're already kind of in a medical or mental health crisis, and they haven't kind of done all these pieces beforehand. Then it becomes really hard, and that sometimes can get in the way of their academic success. So really being proactive about making sure all the pieces are in place is really important. All right, and I guess that was all of my presentation. So thank you. I can open it now to any questions, if there are any. Let me see.
I think there are two in the chat there, Nicole.
Okay, I'm trying to find it here.
Uh-huh.
Okay, so can students transfer their current prescriptions to the UVA pharmacy? Absolutely, yes. So they just need to contact the pharmacy and get those transferred over, which is, again, super convenient because it's right there. For people from Virginia who automatically had their vaccine records in the portal, is all they need to submit for the pre-entrance health form, the TB surveys. And I apologize because, again, that would be Dr. Hayden's expertise, and I don't know. We will be having a session during orientation, so I recommend that you attend that. Or you can reach out to our general email address and just submit that question if you go onto our website, and someone will get back to you, very quickly. So I would, reach out. See. Can you share about a student getting allergy shots on campus? So yes, we do have an allergy clinic within medical services. I'd encourage you again to go on the website, look at that particular clinic, the allergy clinic, to learn more. Again, that's Dr. Hayden's area. But we do have students who regularly get their allergy shots through our medical services. So if that's needed, it is available. Okay, so similar next question, can serums be transferred to UVA? That I do not know, like how that works exactly, but I would go on the website and check that out. And what is the 2025-26 health cost? And I don't know if you're referring to the health insurance or the comprehensive fee. And I don't actually know either of those offhand right now. We actually are changing our insurance provider, and so more information is going to be coming out very soon about that cost. And then the fee changes every year. There is a website that goes over all the fees, and so you can find that on the UVA website in terms of what the different fees are. Parent with a power attorney signed by the student, is it enough to access the student's medical record or being included? No, the power of attorney is not enough. We still like to get that consent form. So we get that question frequently, and we still want to get the consent form from the student. Any last questions?
I think one more just popped in there, Nicole.
Okay, thank you. Does
Mhm.
UVA accept Kaiser? So Kaiser is challenging, um, and no, UVA does not accept Kaiser insurance, and we don't have a Kaiser facility very close to the university. So we often recommend that students with Kaiser either be able to get, say, in Northern Virginia to a facility that they can use, or transfer their care, if possible, to student health in such a way that they can use our services here, but if they need to get the prescriptions filled, they might need to do that through Kaiser, um, or consider getting a different insurance. The student health insurance might be helpful, but yeah, Kaiser tends to be a tricky one for students coming to UVA, unfortunately.
I think, is that does UVA accept Cigna?
I believe so. I believe so. I don't want to say like 100% sure because I don't have it memorized all the insurances, but that's very common insurance. So they accept almost anything. But I know Kaiser just tends to be unusual because it's really the Kaiser issue, not so much, the other facilities. When are we able to switch to UVA's student health insurance? Again, I think information is coming out about that soon, but that July 15th day, I would keep that in mind and look on our website, and we should have information posted, yeah, within the next few weeks. So just keep your eye out. And please do both if want to attend our session during orientation or come to the resource fair that's in Newcomb. We have our insurance specialist who attends that resource fair, and she is a resource herself, who can answer all these questions much better than I can. So I encourage you to take advantage of that.
Let's see. Any other
Oh,
questions?
UVA health insurance can be used in Northern,
Oh,
yes,
I think that's an incomplete.
Virginia.
Mhm.
Yeah.
Our student is covered under a high deductible HSA plan. Can they also have the UVA insurance? Do they have to?
Again, that'd be a great question for Kelly Gildersleeve is her name, our insurance specialist. Um, I would go on our website too. I can't remember if I don't think her email address is directly on there, but you can email the student health general email and they'll get that to Kelly. And again, quick turnaround time. She's wonderful.
Mhm. She is good.
Mhm.
Um, any other questions from the group? Okay, well, with there being none, thank you so much, Dr. Ruzek, for your presentation tonight. Thank you all to our families, our students for asking really great questions. We look forward to seeing you all in at orientation this coming Monday. Wait a minute. I think there's one more question, but I think it may be an insurance question. Can UVA insurance use to see a doctor in Northern Virginia?
Yeah, so it is United Healthcare Insurance, so it does transfer. And yeah, so we were Aetna, but we're moving to United Healthcare, and it is a student plan. However, it's different kind of than the general United Healthcare plan, but it can be used more broadly than just at the university. So the answer is yes.
Good. We like to end
Mhm.
on a yes. Well, thank you again, Dr. Ruzek. Thank you to all of our families and students for joining us in this webinar. It was recorded, and so if you wanted to, we'll post it on our website. And if you need to, you can always go back to to the recording. There's a Wednesday webinar tab on our website, and we'll be sure to post this recording there should you need to use it as a reference as you prepare to come to UVA. Thanks again for everybody's good participation, and thanks once again to Dr. Ruzek. Have a good night, everyone. Good
Bye.
night.
Thank you.
Bye-bye. Thank you.